South Africa reported its first case of the COVID-19 pandemic in early March 2020. Since then, it has become the epicenter of the pandemic on the African continent, with the number of cases and deaths continuing to rise. Under the leadership of the resident coordinator, Ms. Nados Bekele Thomas, the United Nations in South Africa response to the pandemic was dynamic, as the country office responded collectively as one UN, while the 17 entities also used their specific agency mandates to provide expertise on targeted issues. As the World Health Organization led the fight against the pandemic globally, the World Health Organization's South Africa office was actively involved in assisting government by fielding dozens of experts to work at multiple levels with the government and national and provincial health teams. Their assistance was felt at every level of managing the pandemic, from the Command Council to contact tracing, as well as providing much-needed training in the health sector. In April this year, the United Nations in South Africa launched an emergency flash appeal for $136 million to support close to 10 million people in need. The appeal will help fund the civil society response and ensure that the needs of key populations and vulnerable communities are met in the response to COVID-19, including continued health support to people living with HIV, migrants and refugees, women and children affected by violence, and communities facing shortages of food and other essentials. On gender-based violence, agencies including UN Women and the UN Population Fund, or UNFPA, played a critical role in raising awareness, disseminating information, and by engaging with civil society, youth groups, and the government to encourage those affected by the scourge to seek help. These agencies also developed innovative methods to reach out to communities on issues related to sexual and reproductive health. Rising unemployment led to further food insecurity and exacerbated already dire situations for many communities. UNICEF used their Buckets of Care campaign to encourage those who were in a position to help to donate about 800 rands or $50, which would feed a family of 4. In addition, the agency continues to work with partners in building hand washing stations in impoverished communities, especially as hand hygiene is a critical factor in the fight against COVID-19. The International Labour Organization provides technical support to government on labour issues and also contributed to a global ILO video reflecting the way in which the world of work has changed due to COVID-19 as telecommuting became the new norm. The UN Refugee Agency and the International Organization on Migration remained active in assisting the migrant and refugee communities in South Africa as they too felt the impact of the pandemic. UNHCR teamed up with the World Food Programme in sounding alarm bells related to food insecurity amidst funding shortages during this time of crisis. UNAIDS has worked with partners to coordinate the United Nations in South Africa plan, providing support to strategic information. Funds already available to the United Nations Joint Team on HIV/AIDS have been reprogrammed to ensure that civil society, people living with HIV, key populations, and vulnerable communities continue to be supported in the AIDS response while also addressing new challenges from COVID-19. The media shone the spotlight on the spread of COVID-19 across the country, as prisoners too were not exempt from the spread of the virus despite being isolated from communities. The UN Office of the High Commissioner on Human Rights played a critical role in encouraging government to consider 19,000 prisoners for parole, as overcrowding in prisons posed a risk to social distancing and thus further spread of the virus. The United Nations South Africa used its voice to show solidarity with the government and the people of the country as they continue to fight against the pandemic through the use of public service announcements and the dissemination of information material in various official languages.
The COVID-19 pandemic
requires us all
to take action,
leaving no one behind.
We support
the government
of South Africa
and urge you
to observe the lockdown,
ensure social distancing, and practice good hygiene.
The United Nations
in South Africa
stands with you.
Count us in.
UN agencies, including the UN Development Programme and the UN Office on Drugs and Crime, to name a few, continue to work with the government on economic challenges in the face of the pandemic and to provide personal protective equipment and other essential items to healthcare workers, government, and communities. The United Nations in South Africa continues to use multiple platforms and its relationship with government and partners across all sectors to play a critical role on the ground in the fight against the COVID-19 pandemic. You can count us in.